Now, to the pro side of things. So things that you should be looking for in the clinic that you're going to. Number one, have they done a Buffalo concussion treadmill test on you? And are they encouraging you to exercise and become more active? Always, 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 at any complete concussion management clinic anyway, exercise and putting you on the treadmill is usually our first step in with anyone with persistent symptoms. There is a load of evidence on utilizing this test to help figure out autonomic dysregulation issues, blood flow impairments, and then using the results of that test to provide you with a subsymptom threshold exercise protocol, and that exercise protocol being very effective for lowering and reducing concussion symptoms. If you're going to somewhere and they haven't put you on a treadmill yet, and they haven't progressed you through your exercises, you're probably in the wrong place, because it just shows that there's so much evidence out there, and if they're not doing it, they're probably not keeping up with the scientific evidence and how things are emerging. Number two, on the pros, do they encourage rehab? Like I said, medication and pills are generally not effective. The treatment for concussion is rehab. Do they provide rehab themselves, or do they have in their clinic, or do they refer you to rehab early on in your recovery? Rehab is essentially now the cornerstone of concussion treatment. It's vision rehab, it's vestibular rehab, it's exercise, it's treatment of the neck. Those are the things that are effective for a lot of the post-concussion symptoms. And if they're not doing that as part of your clinical management, you're missing out on generally the cornerstone of concussion treatment. Number three, on the pros, do they have any training? So do they specialize in this area? Concussion is not covered in healthcare curriculums. At least it wasn't up until even just a few years ago. There was a study in Canada in 2012 that showed that the majority of Canadian medical schools did not have concussion on the curriculum at all. Those that did, the average amount of time spent on concussion was less than half an hour of your entire 4 years of medical school. That's not enough to know the nuances of somebody who's got a complex post-concussion syndrome picture. Secondly, because of that, and it's not just on the medical side of things, it's also in PT programs, chiro programs, other healthcare programs, not covered in the majority of healthcare curriculums. So in order to be in this space, you've had to do additional training. And then what type of training has that been? Or is the person involved in researching concussion, right? They may not have had any specific training on concussion, but they're a researcher in the space. They've published articles in the space, and they're keeping up to date with the research in the space. That's one element. Or they've taken additional training and courses and received certification in concussion specifically. And just a note on that, I wouldn't just rely on credentials. Just because somebody is a doctor doesn't mean that they know anything about concussion. And just as an example of this, there was a study that was done. This is again in Canada. Canada's done a lot of the work on this, looking at the gaps in knowledge. And you look at emergency room physicians versus sports medicine physicians. Emergency room physicians, 40% of emergency room physicians surveyed did not even know that there was any type of consensus statement or guideline for the management of concussions. And this was 16 years after the first guidelines had been published. So by this point, when this was published, there was 4 iterations of the International Concussion Consensus Statement, yet 41% of emergency room doctors didn't even know that there was any type of guidelines or consensus statements on concussion. But in contrast to that, there was only 3% of sports medicine physicians who didn't know that. So you can tell, just because somebody is a doctor doesn't mean that they know concussion. You're more likely in the sports medicine realm to find somebody who's learned more about concussion or has taken additional training or has more specialization in it than you are with Emerge. Secondly, don't just rely on MD, because there's a lot of PTs, a lot of DCs, a lot of ATs that know a lot more about concussion than a lot of medical doctors. So don't just rely on credentials. Rely on more experience and additional training and specialization in the area, right? Are they treating a lot of concussion patients? Do they see a lot of these people? Because it's a lot different, right? Just because they're a neurologist doesn't mean that they have any type of knowledge when it comes to concussion. Because to be honest, a lot of times concussion is kind of below the neurological realm, because concussion doesn't present with overt neurological findings in many cases, particularly in the chronic setting. So they're going to do a neurological exam on you, and if it's normal, that's pretty much where that ends. So they're good for ruling out, more sinister things and making sure you don't have anything worse going on. But when it comes to then treating those particular symptoms, generally the treatment's going to be a lot of rehab, a lot of education, things like that. So just because they're a neurologist doesn't mean you're in the right place. And that goes for all sorts of different professions as well. Just because they're a vestibular PT, a lot of times people go to vestibular PT because that's where they get referred. But concussion is not necessarily vestibular. And there was a critical appraisal done, so this is a type of research review done on vestibular rehabilitation. And this was by Booth, and it was in 2019, so it's very recent. And what they found in scouring the research is that if you took all the patients with dizziness following concussion, so these are patients that have a concussion and then also have dizziness associated with that concussion. If you took all those patients and you treated them, you would have to treat between 2 and 4 patients just to see results in one. These are patients all with dizziness and they're getting vestibular rehab. You would have, basically, your success rate with vestibular therapy is only going to be between 25% and 50%. So that means between half and 3/4 of your patients are not going to get better with vestibular rehab alone. So if you're a patient right now and you're going to vestibular PT because that's where you were referred to, and you're still not getting better, it's because something is likely being missed. There's other causes of dizziness that go along with concussion. And a lot of times we think dizziness, we think vestibular, but that's not the case. It could be an ocular motor problem. It could be a neck issue. It could be a blood flow issue, autonomic nervous system. It could be a bunch of different things, but oftentimes, including healthcare professionals, right? A lot of times doctors will think vestibular, they'll think vestibular PT. And a lot of vestibular PTs will think, well, because I know vestibular, I know concussion. But vestibular does not equal concussion. So we have to make that distinction. Concussion is unique, so the training should be kind of concussion related, right? Just because you have training in neuro PT, it's different when you're rehabbing a stroke versus when you're rehabbing a concussion patient, or a spinal cord injury versus a concussion patient. Concussion is kind of a unique subset, so you have to know about concussion specifically. Word of mouth. So this is another pro. Are there reviews? Do you know people that have gone there personally? That tells you a lot of stuff. Just because they have a fancy website and they market fancy tools and they do fancy imaging and all that stuff, are people actually getting better when they go there? Are they seeing positive results? Keep in mind that everyone's different, right? What your symptom profile might be is different from somebody else's, and what might have worked for somebody else may not work for you. I've had patients personally that have gone to people that have, they'll say, oh yeah, I had my neck treated, I did vestibular, I did visual, and then they come see me and I'll find issues going on still with their neck. And then if I treat their neck versus somebody else, I'll have a positive result, whereas that person maybe not have. So just because you've tried a particular type of treatment, let's be it even vestibular or ocular motor or neck or exercise, but if it wasn't done in the right way or they missed something on you, doesn't mean you should completely rule that out as a possibility. And I feel a lot of people do that, because I will get Instagram DMs from people that'll say, yeah, I've already done, neck stuff. Okay, well, what type of neck stuff? And I don't know without touching you, whether or not that the right spots were hit or what else. Okay, so just because you've tried something doesn't mean it's not going to be effective at a different clinic or with somebody else. But also look for reviews, look for people that have gone there. Word of mouth is huge. Are they evidence-based? So this is pro number 5, I think. 4 maybe. Are they evidence-based? This is sometimes tough to figure out. You're not going to really know what type of research this person does, or if they read any, or they keep up to date with it. But do they talk about studies? Do they talk about research? Do they talk about, yeah, there was a study published just this past week about this or that? Because that'll give you some indication that they're actually reading and keeping up with it. And if they're not giving you that type of information or those types of answers, have there been any studies done on this or any studies done on that? They're probably not reading them. And if they're not reading them, well, how are they going to be keeping up with the research if they're not actually reading the research? So just an example of this, at complete concussion management clinics, we make our practitioners go through, it's a like 8 to 9 week training course. And then when they've done that, we monthly research updates go out to them on every single month. So our research team reads all the research every single week. We synthesize it, disseminate it, break it down, and then we send it out to all of our clinics so that they get all of that information every single month to keep up with how things are changing and evolving, because there's over 100 studies published every single month in this space. And if you're not keeping up with it, you're going to get left behind very quickly. So find somebody who's evidence-based, as hard as that is to do. So again, just to kind of recap, the big things for treatment are exercise, rehab, education reassurance, evidence-based, avoiding things like rest, inactivity, reduction of, anything symptom provocation, not going straight to medications and simply kind of pushing you into symptoms a little bit, encouraging you to get back into activities, back into life, encouraging exercise, and then rehabilitation is essentially the cornerstone for concussion treatment.